I do want to talk a little bit more about the pathogenesis of HFpEF. So I guess, like, what is it really that's causing?
So the pathogenesis of HFpEF is really complex. I'm not sure anybody fully understands what happens. We used to think of HFpEF really as a disease related to hypertension and hypertensive LV remodeling that lead to LV stiffness. And I think this has really shifted more recently to this idea that HFpEF happens in multi-morbid patients with central contributions from obesity and cardiometabolic disease. We think that those predisposing factors probably incite systemic inflammation that then leads to endothelial dysfunction and altered myocardial energetics and abnormalities in skeletal muscle. And so it's a lot more complicated, I think, than we initially appreciated.
It looks like there has been this increasing diagnosis or prevalence of HFpEF. Do you have any commentary on why are we seeing HFpEF in everybody's one-liner? And do you think this is actually an increased prevalence and diagnosis of it, or is it a mistake?
That's a great question. So there are probably several different components. I think fundamentally, both the incidence and the prevalence of HFpEF is increasing. And we don't know for sure why. I suspect it's because of the growing obesity epidemic and all of the downstream consequences of that. And we know that obesity and associated metabolic dysfunction are major contributors to HFpEF risk. So I think that's part of it is that the disease incidence and prevalence is truly
So while you're talking about obesity as one of these main risk factors for HFpEF, could you review for us some of the other risk factors?
yeah. I would say they're the classic cardiovascular risk factors we think about for anybody. Um, and that includes increasing age, the presence of hypertension, and ischemic heart disease. What's interesting is that these risk factors are really overlapping and shared between people who eventually develop HFpEF and those that develop HFrEF. We're beginning to understand that the propensity toward HFpEF is greater among people with obesity and metabolic dysfunction. And there was one really interesting study that looked at physical inactivity actually as a risk factor specifically. So those are sort of the main risk factors I think of in terms of future HFpEF risk. One other thing that I've been really interested in some of the work together with my collaborator, Dr. Emily Lau at MGH, has been this clinical difference that we know of where the prevalence of HFpEF is much greater among women compared with men. And she actually led a really interesting study showing that there are probably sex specific factors that predispose women to development of HFpEF over HFpEF. We don't really know what the underlying mechanisms are, but I think our understanding of sex specific factors is evolving.